Thank you so much for staying tuned to Cast TV. We always appreciate your time. Tonight, as you can see, I'm sitting in for Chesang Karo. It is a special segment, and I'm really excited to be bringing this conversation to you tonight because today we recognize National Autism Acceptance Month, and we are diving into an important topic of autism spectrum disorder, which affects over 2 million people in our country. I am excited to have a special guest with us, the nominated senator who represents persons with disabilities, women, and youth. She is an expert in disability rights, including autism, and has been a strong advocate for improving the lives of those with disabilities. And she's a celebrity. I'm sure you're dying to know who I'm speaking about. Her name is Crystal Asige. Without further ado, please help me in welcoming her in the program.
Wow, that is so special. Thank you. Thanks a lot. Thanks for inviting me. It's a really important conversation to have. People on the autism spectrum and people with neurodiverse disabilities in general never really get visibility. We never really understand who are these people, what does it mean to be neurodiverse or to have autism or to be on the spectrum, like you said. So I think it's a poignant conversation to be having, especially in the month of April, which, like you said, is Autism Awareness Month.
Yeah. Mm-hmm. I have to say that when I read the write-up that forced me to look out for you and have this conversation, I was really intrigued about the facts and figures that were there. But like you've said, the conversation needs to be had now, and especially because this is the month that you need to look at the autism and creating awareness, but not only this month, but going forward, right? Mm-hmm. But the figure that stood out for me is 4%, and especially if we look at the 2 million people living with autism in the country, right? Mm-hmm. How are we doing with that? What is the awareness around that?
So the awareness is low, unfortunately. There are many people who come to my office, even before I started working in Senate, talking to me about neurodiverse disabilities. I try to educate myself, of course, on a vast array of disabilities, because disability is not just one. When you meet one person with disability, you've only met that one person and their characteristics with the particular disability that they have. But it's so diverse, right? From neurodiverse, like we're talking about today, to sensory, which is eyesight and hearing, and speaking, and of course there are physical disabilities of all types. So I think neurodiverse disabilities have not gotten enough attention because we as Kenyans don't understand it. It's something that seems to be more spoken about in the West, because they have technology, they're a bit more advanced in their healthcare, and so us in Kenya, we resort to calling people on the spectrum or people with developmental disabilities as mental retarded, or mad, imbeciles, such very derogatory words, and we don't seek to even understand what is this about, how can it be managed, how can we support. We just sort of throw them away in this pile of they're not supposed to be in society, wacha wakae nyumbani, which is completely wrong. And then when you isolate these people like that, they draw more recluse, they become less confident, and they don't come out in society at all, and therefore it's a spiral that just continues to.
Mm-hmm. I'm sure that people are watching right now, and maybe that was their thinking. Like when you speak about someone who's autistic, they could be having some of this characteristic, or some don't even have, because we've been talking about spectrum, right?
Right.
So maybe for someone who is trying to understand it from now and having sat in this seat where now you get to interact with some of the people who have autism, yeah, are there distinguish cases? Is there something that you can look at and say that this one has autism or not, or what? How do we find out?
So it's very nuanced because there's a spectrum. So spectrum means that there are people who are slightly autistic all the way up to extreme. So the spectrum can be a little bit tricky to try and understand who is on the spectrum, how badly off they are, so on and so forth. But statistics show that worldwide, we can start there are about 75 million people on the autism spectrum, okay? And then that's about 1% of the world. And then now in Kenya, where we are number 46, we're ranked 46 in the world as in terms of autism cases, which is quite high because of how many countries are in the world. However, we are not sure that is an accurate number because we're just sort of guessing according to who has brought themselves forward. Okay, in Kenya, there are many people with disabilities. Their stats show that about 16% of the entire world is disabled, right, or at least has some form of disability. And if you take that 16% and you put it to 55 million people who are in Kenya, 55 million divided by 16% is about 7.6 million people. So that, if that is the number that we are averaging at as people with disabilities in general, then within that there are approximately 4% with autism. However, that 4% we're not completely sure it's accurate because of identifying people with autism, getting them into hospital so they can be assessed properly, and then of course getting them back into society so they can rehabilitate and try and live as full lives as possible. So 2.2 million is what we are estimating in Kenya. Now, the characteristics of autism are around sort of like impaired speech, involuntary movements and behaviors. We also characterize them as a little bit, they take a little bit more time to express themselves. They're very quiet as well. They have awkward social skills. So somebody who, when they're in public, they don't really know how to act, or rather they act a little bit differently from non-disabled people. So there are very, slight things that you have to really be paying attention to, especially those who are sort of slightly autistic rather than on the other side of the spectrum. And without proper diagnosis, without proper assessments, then you can't really know the full extent of how many people are in Kenya living with autism. However, this is why I'm here and I'm doing things that I'm trying to do with my bills. For example, in my Persons with Disabilities Bill of 2023, it's the first time ever that people with neurodiverse disabilities are being mentioned in a bill in this country, right? And that's because of the work that I've been doing for years before I came to Senate, and the interest I have in disability in general, and the passion and the knowledge that I have of how it feels like to be left out, how it feels like to not be counted, how it feels like to be ignored. People don't really understand what's going on with you, so wanakuacha. So because I have felt it in my own life and I know what it's like, that's why when I just see somebody being left out, something happens in my heart. I'm just like, injustice for me, I take it personally. So I have added neurodiverse disabilities and provisions for those in that group in my bill, so that they can also be recognized by law and get the help that they need from government. And right now in Nairobi, I know that there is one very popular center that works with autistic kids and kids with developmental disabilities, but it's not enough because it's 47 counties. Yeah, there's so many kids. Statistics also show that in Kenya, 70% of PWDs live in rural areas. So majority are in Trans Nzoia, Lamu, Garissa, and we don't know, we've not identified them yet because first of all, our healthcare workers in the communities, they've not been trained to identify these kinds of, invisible disabilities. They're called. They're invisible, not like somebody who's in a wheelchair or using crutches or amputees. So these invisible disabilities are not trained. People are not trained on them in medical school, and therefore when they go out into the counties, into rural areas, it's hard for them to identify, and therefore they don't get the help that they need.
And you've mentioned the gaps that are there and the bill that you've brought to the table, and you're going to expand a little bit on that, on what it will mean when you have that bill already for the PWD or people living with disabilities in this case. But also when you're talking about the figures globally and even within the country, there's something else you mentioned in your write-up about Kenya being 46 globally. Yeah, that's a huge number, right? And with the gaps that you've mentioned, people not being trained on this and where we needed the resources, yeah, this is an issue, right? Mm-hmm. What do you see as some of the challenges that these individuals who are living right now with autism in the country, as you've said, are facing, if you can mention some of them?
Yeah, so in my research and the work that I do, I found quite alarming, pieces of data. For example, in the world, there are more kids who will be diagnosed with autism than there are with cancer, diabetes, and AIDS combined. More kids will be diagnosed as autistic than those kids with cancer, diabetes, and HIV combined. That's crazy. For me, I think that's crazy. So when we come back to Kenya, the challenges that these types of kids and adults as well face are things like, because they don't communicate well, people think that they are retarded, in quotes. They mistreat them. There are cases of people who enter matatus, autistic people entering matatus and not being able to communicate well with the touts, with the driver, how to pay, how much to pay, and so they get abused, they get yelled at, things like that. There are those kind of cases. There are cases where autistic people look for healthcare services, and because the social behavior is a little bit awkward. That's how it's perceived. And they don't know how to express themselves as clearly or as sophisticatedly as other people, then they are misdiagnosed or not treated correctly in hospitals, right? Chased away, told, I don't like using this word mjinga, I really hate it, but that's how they're referred to. They face challenges, especially kids, autistic kids, right? Because of these characteristics that they have. They're very prone to kidnapping, being wandering away when they're in public. If you just leave them just without being observed, they can just walk away and start wandering around, which makes them, of course, like I said, kidnapping, dangers, walking into the road by mistake, because they're not aware of what they're doing. It's not voluntary. Yeah. So those are the kind of challenges that they're facing, and I know many parents who have autistic children, even here in Parliament. Their kids are autistic, but for one reason or the other, they don't come out to say, publicly anyway. They keep it within the family. We still have cultures who think if you have a kid with a disability, especially one that is not understood by the public, like I say, a wheelchair user, you can understand, okay, that's a PWD. But autistic kids, kids with cerebral palsy, kids with multiple sclerosis, these kinds of autoimmune diseases, they don't get the support because people will say, oh, your parents must be a witch, or your family must be cursed, things like this. Still happens. We're in 2024. We're in 2024. And these things are still so prevalent in our communities. So, of course, when they're in school, autistic kids specifically, teachers mistake their behaviors for indiscipline. Like, you're just trying to be, naughty. You're just being a cheeky. When the class clown, nitakuonyesha, things like that. So they get disciplined. Corporal punishment as well happens a lot with kids with disabilities who can't express themselves well enough for teachers to understand. So teachers need to be trained as well, not just healthcare workers. And then, of course, at home, parents and caregivers who also don't get it, who don't know what's wrong with my child. They just think my child is difficult, my child is this. They beat them up. They take them to the local church for prayers, exorcisms. I've heard stories, imagine, exorcisms, so that their child can be, in quotes, normal. And isolation, of course. So I really feel, especially for children who have autism or on the spectrum, I really feel for them because they can't express themselves, and it's not their fault. It's not something that they were born with because they've done something wrong or they've done anything. They're just born that way. So these are challenges that we're already facing. A lot of lack of education around these kinds of diseases, especially with parents, like I said, and caregivers, because they're the first point of call. When you have a child, you're the one who's taking care of that kid, right? Uko naye kila siku. And it's for you to identify, okay, there's something, maybe their speech is a bit slow, they're not hitting these milestones the way other research I've done or people I've seen and their kids, how they do it. So let me take them to hospital to get assessed. They don't know that. They just think, 1, 2, 3, whatever it is that they think, or they fear, or they don't know where to go. They have no knowledge of where to take their children. So there's that. And like I said, training of medical personnel, and then training of the public, the general public, Kenyans in general. Unfortunately, we have so many other problems that we are facing that disability comes at the bottom of the list of problems that we should really address, because we have healthcare issues, we have education issues, we have mambo za taxes, we have mambo za mafuta, now we have climate change ambayo imeingia pia. So now every time disability becomes lower and lower and lower on the priority list, unfortunately.
Senator, you've spoken about stigma, vulnerability, and my heart is breaking when you're talking about the reason for this is misdiagnosis, like not knowing exactly what's ailing these individuals, and it causes now all these issues that we are seeing. Yeah. Early detection, and you've said when we know it's a thing now that we need, once we know it we can handle it, right?
Yeah.
What are the measures, or where are we in Kenya in terms of trying to capture these cases early, or what are you saying?
Unfortunately, we are not in a good place for all the reasons I've mentioned. And I have been working with the Ministry of Health, trying to engage the CS and her team on how can we start putting money away in the ministry for training on these very specific issues. Like get together a group of stakeholders, which are mostly parents. Let's have, for example, a few days workshop, 2 or 3 days workshop for parents only and caregivers alone. You teach them what are the signs that you should look out for after you've left the labor ward, when you go home for the first 2 months, 6 months, 12 months, those kinds of time periods. What are the signs you look for? And what should you do afterwards? Where should you go? Which facility is close to you in your county that you can go and say, okay, I've noticed 1, 2, 3, nataka muassess mtoto wangu. And then from there, they can tell you where to go or what to do next, right? Recommend where to go. That's one thing. And then I told the ministry, after you've done that, now let's also train medic staff, from those on the ward level all the way to dispensaries, etc., mpaka level 5, because you never know what kind of patient will walk into your door, right? So let's also train medical professionals and healthcare, especially, like you say, those ones who can help with early intervention. And those ones mostly are community health workers, those ones who are on the ground, who can work with chiefs in different wards, so that chiefs can say, okay, kwa hii boma nimeona mama amesema 1, 2, 3, 4, 5, can you go and have a look at the child, can you go and assess and give me your diagnosis like this. And then another group that we should also train, teachers. That's the Ministry of Education rather than Ministry of Health. So that's where I think Kenya should go, apart from my bill, which will mandate these ministries to prioritize matters around neurodiverse disabilities. Implementation is always the key. So as we say, implementation in Kenya is the problem. Our laws are beautiful, they're very well thought out, very well drafted, but the problem is implementation. How do we get ministries to really prioritize budgets? There is an activist in Bangladesh who says it very well. He says, unfortunately, when there needs to be budgetary allocations and prioritization of money to this project or that ministry or the other one, disability always gets the least attention. It's always the last of the list. And if there needs to be cuts in budget, because we are overspending for whatever reason as government, where should we look first? They look at disability. You see, because there is no prioritization of this space and this sector. So we really need goodwill all the way from the president. And then that's when things will really change. Let me tell you that the 2003 Kibaki, in the Kibaki era, President Kibaki the late acquired a disability. Do you remember when he was in a wheelchair at some point? He acquired a disability whilst he was president. So that is what made him, because he was now living as a person with disability, he couldn't travel as easily, he wasn't as mobile as he used to be. That's what made him focus on disability. And the very first disability bill in Kenya happened in 2003 because of Kibaki undergoing or experiencing disability himself. And that's what I mean about goodwill. It needs to come from the top. But I don't want people to think that I'm saying that a president has to have a disability for them to really understand so they can make changes. No, don't let it get to that place. Don't wait until you have to feel it yourself for you to think, oh my goodness, this is so neglected, we have to prioritize it. But just do it because of goodwill, because you understand there is a population of people who are not being helped and their issues are not being addressed, and do it from there.
Yeah. Thank you, Senator. I want to come back on this issue and to understand the key provision on the People with Disabilities Bill and also where we are sitting right now. We're going to take a short commercial break. When we come back, we'll be continuing this conversation. Her name is Senator Crystal Asige, and she's here with us here at the Telelinda program to speak about autism and where we are as a country in terms of identifying these cases and dealing with it as it is. My name is Chemtai Kiri. Don't go so far.